Quick reminder, iron deficiency anemia is a common condition characterized by a lack of iron in the body. The causes of iron deficiency anemia vary by gender and age. In women, gynecological and digestive factors are often predominant, while in men, digestive causes are more common. In elderly individuals, it is important first exclude neoplastic etiologies. Here are the main etiologies of iron deficiency anemia. Firstly, malabsorptions in the cases of celiac disease, inflammatory bowel diseases, infections, pancreatic insufficiency, or due to certain medications. Chronic bleeding, whatever from the digestive system, gynecological system, or others, such as rectal bleeding, hematuria, epistaxis, or hemoptysis, and others, can lead to iron deficiency anemia due to the chronic loss. Cases where there is an increased iron demand, such as during pregnancy or lactation. Dietary iron deficiency is also a significant risk, especially for vegetarians or those suffering from malnutrition. Other factors include chronic kidney disease, iron chelating substance, commonly found in heavy tea drinkers, and genetic disorders such as transferrinemia due to the presence of antibodies that attack transferrin receptors. A diagnostic test aimed at identifying the etiologies should be guided by clinical findings and the patient characteristics. The most common exams to be performed include endoscopy and radiological and biological studies. In young women, pelvic ultrasound and gynecological examination are often the first steps. If an inclusive, an endoscopy may be performed, followed by colonoscopy if necessary. In men, endoscopy is usually the first diagnostic step, followed by a colonoscopy if necessary, along with a prostate-specific antigen test to rule out any prostate cancer. Thanks for watching, and I'll see you in the next one.